The Patellar-Pubic Percussion Test is a physical exam maneuver designed to evaluate for fractures of the proximal femur and pelvis. This exam should be considered in patients presenting with hip or pelvis trauma accompanied by pain, tenderness, limited range of motion, inability to bear weight, or an antalgic gait. It is performed with the patient relaxed in a supine position with both legs extended. The examiner palpates the pubic symphysis and firmly places the bell of the stethoscope directly over it. Subsequently, each patella is individually percussed by the examiner approximately 5 to 10 times with attention paid to the sound transmitted to the stethoscope. A fracture in the proximal femur and/or pelvis will result in a duller, more attenuated sound compared to the unaffected or asymptomatic side. Equal sounds bilaterally signify a normal exam. A vibrating 128 Hz tuning fork can be used as an alternative to percussion, with the tuning fork placed over the patella or the medial femoral condyle. Normal and abnormal exam findings are similar to percussion. The sensitivity of this maneuver ranges from 85 to 95%, the specificity from 70 to 86%. A 2013 meta-analysis revealed a pooled positive likelihood ratio of 6.1 and negative likelihood ratio of 0.07. Thus, a positive result of this test moderately increases the likelihood of fracture, and a negative result largely decreases the likelihood of fracture. This test can also be useful in determining the need for advanced imaging to diagnose occult proximal femur and pelvis fractures. One study demonstrated a positive patellar-pubic percussion test in 8 of 11 patients with negative x-rays that were ultimately diagnosed with fracture on CT. As a clarifying statement, the physical exam maneuver has not been studied for the evaluation of femoral neck stress fractures or pelvic stress fractures, and therefore should not be utilized to aid in the diagnosis of these bone stress injuries without further study. In summary, diagnostic imaging is still indicated based on clinical judgment in the presence of a normal patellar-pubic percussion test. However, this maneuver should be added to the family physician's toolbox to lower the risk of missing a proximal femur or pelvic fracture and its subsequent morbidity.